We had the president kind of riffing on masks for the last 2 days, telling us from his standpoint that maybe some scarves are better. And then just this evening, the mayors of our two biggest cities, New York and L.A., are telling people if you go outside, put something on your face. Yet silence, crickets from the official part of the government that would lay out such a thing. And citizens have been asking for weeks, should we wear these things or not?
There is no compelling evidence one way or the other that putting a face mask fashioned at home is going to protect you. Some evidence suggests maybe it does. Other evidence out of China, it doesn't. No conclusive evidence. And so if people want to make their own face mask at home, by all means, no one's going to stop you. But here's the concern. Is this going to be an off-ramp from let's not consume precious PPE that you're highlighting is a desperate need in urban areas like New York City for our healthcare workers? What we don't want is mixed messaging causing people to purchase surgical masks, other PPE. So if we can restrict it to homemade masks, fantastic. Do I think that's in practice going to happen? Who knows? And this is so confusing, and the messages change every 3 days. We need consistency, and we need evidence-based policies now, a national lockdown.
Shannon Pettypiece, you heard the doctor. We see you in the daily briefings on live coverage. Is there anyone who is willing to admit that a national audience, just to the conversation we were just having, is getting inconsistent, misleading information, and often, again today, straight up misinformation from that podium?
Well, I mean, you could see the inconsistencies, as Dr. Gupta is talking about, in this briefing today. It was 2 hours and 20 minutes of inconsistencies, and at times the people on the stage there on the dais contradicting each other. Take the issue of face masks. You had the president, when we've asked him about this almost every day this week, is there going to be a recommendation on face masks? And you have the president recommending people wear a scarf and saying that in some ways a scarf could be better than a surgical mask because it is thicker. I mean, maybe the doctor can address that, but I don't see, doctors wearing scarves in the operating room. So I'm going to think maybe a surgical mask is a bit better, but they don't want people going out and buying surgical masks. So the president's talking about scarves. But a moment later, you had Dr. Birx almost contradict that by saying that, a real cautionary message saying we don't want to give people a false sense of security. We don't want them to think because they have a mask or a scarf on, they can now go out to a restaurant or hang out with their friends. So just in a breath, you have them contradicting each other. Jared Kushner, you had come up to the stage and talk about this data-oriented process they have for allocating resources, yet at the same time talking about an anecdote from this week where instead of using data, it was a call from one of the president's friends in New York that caused him to distribute a large bulk of N95 masks to a New York City hospital. So a phone call from a president's friend gets you masks doesn't necessarily sound like this thorough data-driven approach he had spent so much time talking about. It's very confusing, and it's confusing for us sitting in the room. It's confusing for me sitting there, and I've sat through every one of these this week, so I can empathize with everyone at home who's confused and not to mention scared at this point.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.